Welcome to the catheter self-care teaching video. At the end of this video, you will learn how to keep your catheter clean, how to empty your catheter bags, how to clean your catheter bags, how to change your catheter bags, how to prevent a catheter-related infection. A urinary catheter, sometimes called the Foley catheter, is a thin tube that drains urine directly from your bladder into a collection bag. This catheter is held in place in your bladder by a small water-filled balloon, so it will not fall out. As part of your recovery from your surgery, you will need to go home with a catheter and will need to take care of it at home. Taking care of your catheter, keeping your catheter area clean. Wash your hands. Gently wash the skin around the catheter and the catheter tube with plain soap and water. Wash the tube in a downward motion. Instead of soap and water, you can also use baby wipes. If needed, pull the foreskin of your penis back to wash around where the catheter is coming out, and pull it back over the head of the penis when you're finished. Pat the area dry with a clean towel. Add a layer of polysporin to the tip of the penis where the catheter is coming out. Do this every time that you clean your catheter area. Clean your catheter at least 2 times a day, once in the morning and once at night. And of course, to finish, wash your hands. You will be going home with 2 types of collection bags, the day bag and the night bag. The day bag will let you move freely during the day. It can be worn under your clothes by strapping it to your leg. The second bag is the night bag, which should be used for when you are going to sleep, as it can hold more urine than the day bag. In addition to the catheter cleaning, you can shower with your catheter and the collection bags. If you are able to stand in the shower stall, shower with the day bag on. If you are unable to safely stand in the shower, use a bathroom chair with the night bag, and let that bag either sit on the ground of the tub or hook the bag where it will stay below your hips. The bags are waterproof, so you do not have to worry about getting them wet. You can dry the bags with a towel when you are done, but be careful not to touch these areas. And remember that you cannot have a bath while you have your catheter. Emptying your catheter bags. You should empty the day bag when it is about 1/3 to 2/3 full, or if you feel that the bag feels too heavy on your leg. To empty your day bag, wash your hands. Place the blue end of the bag over the toilet and turn the valve to the left, counterclockwise, and drain the urine into the toilet. Do not touch the actual opening with your fingers. You can open and close the port by keeping your fingers on the valve. When the bag is completely empty, turn the valve to the right, clockwise, to close the valve. Finally, wash your hands. For your night bag, empty it in the morning when you wake up or when it looks full. To empty your night bag, wash your hands. Unhook the drainage valve from its clip at the bottom of the bag. Place the valve over the toilet and slide the valve to the left to open. Do not touch the opening with your fingers and just let the urine drain into the toilet. When the bag is empty, slide the valve over to the right to close. Wash your hands. If you forget which direction it is to open or close the valve, this is also written on the bag. How to clean your catheter bags. Pour a teaspoon of vinegar or 1 pump of unscented liquid soap into the bag from where the bag will connect to your catheter. Run the bag over a small stream of water and fill it to about 1/3 full. Then swish the bag around. Then you can empty it through the valve. Changing between the day and night bags. To change between the bags, you need to know how your catheter is connected to the collection bags. The catheter itself is just the tube that comes out of your body. Everything else is the collection bag. To change the bags, wash your hands. Empty and close the bag. Wash your hands again. Put a towel in between the bag and your leg. You can also do this in the washroom. Use 2 fingers to pinch your catheter tube closed so that the urine doesn't leak during the bag change. Keep it pinched until you are done changing the bags. To take the bag off of your catheter, gently roll the catheter tube away from the bag. Do not pull on the catheter or the bags. Gently rolling on the catheter will help you get the bag off. Take the bag that you wish to put on. Take the blue cap off of the end so that you see the clear part of it. Connect the bag to your catheter. Do not throw the blue cap away. Keep the blue cap to cap off the bag that you will not be using. You may now unpinch the catheter and let the urine continue to drain out into the collection bag. Wash your hands again. The steps are the same when changing the day bag to the night bag or changing the night bag to the day bag. You can leave these bags in the washroom with the blue cap attached to the tip. Try to leave them where the opening of the bag is not touching anything. How to prevent a catheter-related infection. To prevent a catheter-related infection, there are 7 key steps that you will need to follow. Number 1, always wash your hands. Wash your hands before you touch the catheter and wash your hands after you touch the catheter. Number 2, drink water if it's right for you. If you can, drink at least 1 liter a day or 4 cups of water. This will help you keep hydrated and help flush out any remaining blood clots from your surgery. Number 3, clean your catheter at least 2 times a day, once in the morning and once at night. If the catheter or the area around it becomes soiled, clean the catheter area again. Number 4, use a night bag when you're going to sleep. The night bag holds more urine than the day bag, so you won't have to empty it during the night. Number 5, to prevent infection, do not let any urine drain back into your bladder. Always keep the bags below the level of your hips. This will allow the urine to drain away from you. If you are going to lie flat, use the night bag and keep it below your hips. Number 6, do not let the catheter tug on you. The catheter should always hang loose so that it doesn't pull on you when you're resting or moving. Number 7, read the information sheets that will be given to you by your nurses. The information may help you understand more about your catheter. Having a catheter is part of your care and recovery after surgery. Your healthcare team is here to support you, so if you have any questions or concerns, ask your doctor or your nurse.